All right, so today we're going to do a deep dive on something pretty interesting. It's autosomal dominant polycystic kidney disease, ADPKD for short. We've got some really cool medical excerpts that we're going to unpack today,
Yeah.
and we're going to break it down so you can really grasp this condition
Yeah.
without having to, wade through pages of technical jargon. It's funny. I was reading through this stuff, and it got me thinking. You ever felt those weird, almost like movable lumps in your sides?
Oh, yeah.
Turns out that could be a sign of ADPKD.
Yeah, that's right. So essentially, ADPKD is when your kidneys develop all these cysts over time,
Uh-huh.
and it starts to affect how well your kidneys can function.
Okay, so it's not just a few cysts here and there. It's like a whole bunch of them, right?
Yeah.
And they're actually impacting the kidney's ability to...
Exactly.
Okay.
And here's where the genetics come in. It's a dominant gene situation,
Mm-hmm.
meaning if one of your parents has ADPKD, your odds of inheriting it go way up.
Okay, so we got the basics down. But what really surprised me was the range of symptoms. I mean, I knew about kidney failure, but high blood pressure, cysts in other organs, I had no idea.
It's crazy, right?
Yeah.
And it's not just like one or two organs. Liver, pancreas, spleen, even your thyroid can be affected.
Mm.
There's even mention of potential links to things like colonic diverticulae, those little pouches in your colon, heart valve issues.
Hold on, colonic diverticulae and heart valve problems. That's a lot more than just kidneys. This is like a whole body thing.
It is. ADPKD can have effects throughout your whole body, which is why it's so important to understand.
Well, speaking of understanding, this source material includes a case study about a patient that has ADPKD, but hasn't actually progressed to kidney failure yet. What would an examination of this patient even look like?
Well, physically examining those enlarged kidneys is a big part of it, but it's also about playing detective.
Yeah.
Ruling out any other conditions that might look similar.
Right. They mentioned checking for hepatosplenomegaly. What is that?
Hepatosplenomegaly is just a fancy way of saying the liver and spleen are enlarged. And since cysts can also cause this enlargement, it helps kind of add evidence to that ADPKD diagnosis.
Interesting. So let's circle back to those genes for a second. They mentioned that there are two primary gene mutations linked to ADPKD, one on chromosome 16 and another on chromosome 4. But it says the chromosome 4 mutation is considered milder. What makes it milder?
So it really comes down to the protein that each mutation affects. The chromosome 16 mutation impacts a protein. That plays a more central role in cyst formation, leading to earlier onset, more severe symptoms. But the chromosome 4 mutation affects a protein that's less critical to that process, almost like a slower burning version of the disease.
So if you have the chromosome 4 mutation, you might develop symptoms later in life, have fewer cysts, and your kidneys would decline more gradually.
Yeah, exactly. But even though it's milder, it's still really important to manage it properly.
Well, that brings us to treatment, right? What are some of the things they mention in here?
Yeah, it's really a multi-pronged approach.
Mm-hmm.
It all starts with addressing those risk factors we talked about.
Right. They emphasize blood pressure control, even going so far as to call out ACE inhibitors specifically. Why are those so important here?
Because uncontrolled high blood pressure puts extra stress on the kidneys, especially when they're already compromised by cysts. ACE inhibitors are a class of drugs that help relax blood vessels, which lowers blood pressure and protects those kidneys from further damage.
Makes sense. And then there's the mention of hyperlipidemia, which is basically high cholesterol. What's the connection there?
Well, chronic kidney disease, which can develop as a result of ADPKD, is a big risk factor for heart disease. And high cholesterol is another major culprit there. So by managing cholesterol levels, we can help reduce that risk.
So it's all about addressing those cascading consequences.
Exactly.
Now here's where it gets interesting. They recommend a high fluid intake and a low salt diet. That seems a little counterintuitive given all those fluid-filled cysts.
I know, right? But hear me out. Increasing fluid intake actually helps flush the kidneys and can even slow down cyst growth. And a low-salt diet helps keep that blood pressure in check, which, as we've discussed, is super important.
Okay, that makes more sense. What about medications? They mentioned something called tolvaptan. What's that all about?
So tolvaptan is a newer treatment,
Yeah.
specifically a vasopressin receptor antagonist. Basically, it blocks a hormone that contributes to cyst growth. It's usually prescribed for patients in the earlier stages of chronic kidney disease, and it can help slow down kidney function decline and reduce cyst growth.
That's good news. But I imagine at some point, medications might not be enough. They mentioned dialysis and kidney transplants as options when the kidneys really start to struggle.
Unfortunately, yes. When the kidneys can no longer do their job effectively, these become essential life-sustaining treatments.
All right, now for the part that really caught my eye, they mention an increased risk of Brain aneurysms in people with ADPKD. That sounds pretty serious.
It is. The prevalence of brain aneurysms in younger adults with ADPKD is about 5%, but it increases as people age. And here's the kicker. Uncontrolled hypertension makes rupture more likely.
So once again, managing blood pressure is absolutely crucial, not just for the kidneys, but for like potentially life-threatening complications.
Exactly. It's not just about protecting the kidneys, it's about protecting overall health and well-being.
This is a lot to take in, and we've only just scratched the surface. It seems ADPKD is way more than just failing kidneys. It's like this complex systemic condition with impacts that reach way beyond just the urinary system.
You're absolutely right. It's fascinating, isn't it?
Yeah, it is.
And there's still so much more to uncover.
Well, on that note, we're going to move on to part 2 of our deep dive, where we'll uncover even more fascinating details about this condition, so stay with us.
Stay tuned. So as we go deeper into this source material, something that really stands out to me is the emphasis on early detection. Catching ADPKD early on can make a huge difference.
That makes sense. I mean, if you can start managing those risk factors we talked about, like before things get too far gone, wouldn't that lead to better outcomes?
Absolutely. It's all about getting ahead of it. For example, managing blood pressure early on can really help slow down the progression of the disease. And even if someone has that milder chromosome 4 mutation, being proactive about their health can still make a big difference.
So it's not just about slowing down kidney damage, it's about preventing those other complications too, like the heart problems and aneurysms we talked about.
Exactly. Thinking back to that patient case study, imagine if they'd been diagnosed even earlier. Maybe some of those more serious complications could have been avoided
Yeah.
or at least delayed.
So this source material also talks about a procedure called nephrectomy,
Mhm.
which is the surgical removal of a kidney. I have to admit, that sounds kind of scary.
It is a pretty significant procedure. It's definitely not something doctors take lightly, but there are situations where it becomes necessary, like if the kidney develops cancer, or if there's chronic uncontrolled pain or infection, or if there's major bleeding.
So it's like a last resort,
Yeah.
only if it's absolutely necessary.
Yes, the goal is always to preserve the kidneys whenever possible.
Okay. It also mentions nephrectomy being done to make room for a kidney transplant. Why is that?
Well, as those cysts grow, the kidneys can get pretty large. Sometimes they take up so much space that it's difficult to physically put in a new kidney without taking out one of the existing ones.
So if you do need to have a nephrectomy before a transplant, what kind of impact does that have on someone? I mean, they're basically living with just one kidney.
Well, of course, there's the recovery from the surgery, but long term, the remaining kidney has to work harder to filter the blood and, keep everything running smoothly.
That's got to put a lot of stress on that one kidney. Are there any long-term risks associated with that?
Well, one healthy kidney can function pretty well on its own, but it does mean that kidneys working overtime. There is an increased risk of developing high blood pressure later on.
Wow. So it's kind of like a trade-off. You're fixing one problem, but potentially creating another one down the road.
Right. That's why the decision to do a nephrectomy is always made on a case-by-case basis, carefully weighing the benefits and the risks.
This is all pretty heavy stuff. It's amazing how much we've learned about ADPKD already and how it affects so much more than just the kidneys.
It's definitely a complex condition, and we're really just scratching the surface.
Yeah.
But I think that complexity is part of what makes it so interesting.
Absolutely. And it looks like we're about to dive into even more detail about this condition in the final part of our deep dive, so don't go anywhere. Okay, so we've covered a ton in this deep dive already. From the genetics and symptoms to the treatments and complications. But there's one more thing I wanted to explore, something they call extrarenal manifestations.
Right. Basically, those are just symptoms or complications that happen outside of the kidneys. It just goes to show how interconnected our bodies are.
So like those cysts we were talking about before, that can pop up in the liver and pancreas and the spleen and even the thyroid.
Exactly. But it goes beyond even that. The source mentions colonic diverticulae, those little pouches in the colon. They're pretty common, actually. But it seems people with ADPKD are more likely to get them.
And then there's the link to heart valve disease,
Yeah.
which affects how well the heart pumps blood. That seems pretty serious.
It is, and we don't fully understand why they're connected. But it's something doctors are starting to pay more attention to.
And they even mention a higher risk of hernias, abdominal or inguinal.
Uh-huh.
What's the connection there?
So hernias happen when?
Yeah.
Like an organ or tissue pushes through a weak spot in the muscle. Again, not totally clear how it relates to ADPKD, but it's definitely interesting.
It really seems like ADPKD is so much more than just a kidney disease. It's a whole body thing.
I agree. It really shows how important it is to look at this condition holistically. It's not enough to just focus on the kidneys. You have to understand and address all these other extra renal things too.
We've learned a lot in this deep dive. We unpacked the science, the treatments, the
Yeah,
complications.
it's been quite a journey.
It really has. And I
All
hope our listeners now have a much better understanding of ADPKD. So if someone's listening and they're concerned they might have ADPKD, what should they do?
I'd say the most important thing is to talk to their doctor. Early diagnosis is key. The doctor can assess their risk factors, order the right tests, and discuss the best way to move forward.
What would you say is like the biggest takeaway from all of this?
For me, it's that ADPKD is so much more than just kidney disease. It can affect so many different organs and systems. And really understanding that complexity is crucial for managing it effectively.
Well said. And with that, we come to the end of our deep dive into the fascinating world of ADPKD. I hope you found this exploration helpful and insightful. Until next time, keep exploring, keep learning, and keep asking those important questions.